Welcome to the Renegade River Show. My name is Mike Hewitt, and my guest today is candidate for State Senate in the 34th District, Nick Sundquist. Nick, welcome to the Renegade River Show.
Thank you very much for having me. I appreciate your time here.
Yeah, I'm excited to get you on. I've got, as you are probably aware, I had the incumbent that you are challenging on the show last week, Jeff Hansen, and so I thought it was appropriate to get you on and not go over the same things, but what was that Reagan said about contrasting bold colors versus pastels? So, the interview that I had with Jeff was good. He's a very, very nice guy. I understand that you folks don't necessarily agree on all of the issues. So I was hoping you could contrast a little bit. And if we could, let's just dive right in. One of the points of difference I think exists, and tell me where I'm wrong, but is on the Michigan Medicaid expansion. He cast a vote yes. How would you have voted?
I would have voted no on the Medicaid expansion. The Medicaid expansion brings Obamacare to Michigan. It's integral to bringing that here. What the state of Michigan ought to be doing is what Oklahoma is doing, and that's suing the federal government for attempting to introduce the mandates, individual and employer mandates. There's no good reason we need to suffer under Obamacare in Michigan.
Okay, so what you're, just to make sure I've got it clear, you're saying that the Michigan Medicaid expansion is a component of Obamacare.
That's right.
Okay, so
I don't think there's any disagreement there between people that are looking at this at all.
Maybe not, but some of them won't answer the question, and I'm not saying that's not what I'm saying about Jeff, by the way, but some of the folks that voted yes refuse to tie the two together, and frankly, I see them tied together also. But one thing we all agree on, in fact, the Democrats and the Republicans and independents, I think anybody that's trying to seek health care in America agrees that what we've got going, even pre-Obamacare, is not working correctly. One of the conversations, the little bit that Jeff Hansen and I talked about, was in fact, probably me, as I went on again about the $9 Motrin tablets and $6 cotton balls. This stuff, it isn't working at this point. So whenever I hear the word reform, I have a tendency of pushing back out of recoil to another more government expansion. But that said, if you're agreeing with me that the current health care program isn't working, what would you say we should do differently?
I think that the health outcomes are actually quite good in the United States by comparison to places that suffer under socialized medicine, if you're looking at actual numbers and health outcomes. However, I don't think it can be argued that insurance costs too much. Unfortunately, what most people have in the United States today isn't really what you would traditionally call insurance. We have prepaid medical care, and there's a long history that goes back there. We could talk about that for a very long time. I think it would be wiser to talk about reforms that would work, and that is to get government out of it. If you look at one of the main reasons that health insurance costs so much and medical care costs so much is that nobody knows what it cost. When my first son was born, I had an insurance policy that has a very high deductible, and so I imagined I was going to be paying for a good bit of his birth right out of pocket. And so I had the temerity to ask the physician how much it was going to cost, and he, without any embarrassment or irony, said, golly, I don't know the answer to that question. The gals in the front office might be able to help you with that. He had no idea. Now, I'm not saying he's a bad guy. He's just working in a system that doesn't have any incentive for him to know. I suppose if he had sat and added it all up, he might have been able to come up with something. A good way to reform health care is something that Republicans have been talking about for some time, and that would be to allow insurance companies to sell their products across state lines. And if there were a larger market for high deductible actual insurance, more people would be interested in knowing what the services they're buying cost.
What would you say to a like a Visa card? So let me try to set it up for you, okay? If we were to determine what the average amount of money that a typical person is forced to pay out in health care, and so what we could do is put that amount of money onto a Visa card, healthcare Visa card, okay, from an insurance carrier, but with the commitment that if whatever you whatever you don't spend over a certain dollar value at the end of the year, you can cash into real cash as an incentive for people to shop for better services and better prices.
If I'm not mistaken, Governor Gary Johnson tried that in New Mexico with a portion of his Medicaid money that came to the state through some sort of federal matching program. And I haven't looked at the actual numbers, but I thought I heard him claim on the campaign trail that it was an enormous success.
Okay,
It stands to reason it would be.
you know, I'm drawing a blank, but there's a surgical clinic, surgical facility down south. I want to say it's Oklahoma City, but I might be still wrong.
I believe it is somewhere in Oklahoma.
Yeah, that specifically do not accept insurance, and the result of that is that they're able to charge significantly less. And listen, I don't know that it's that we're making I don't want to paint insurance as necessarily the problem, but how I see it, and I'm a layman here, but how I see it is that insurance has been so regulated that there's a giant bureaucracy within insurances and indeed within healthcare providers that just to communicate back and forth. In fact, Jeff Hansen talked about the amount of work that it takes for billing. He didn't use that word, but for the medical billing has become an industry of its own that's kind of been plugged into our healthcare that's costing us a lot of dough. And so that clinic that we're talking about down in Oklahoma City, they're significantly less than the average 6-day hospital stay that I quoted last week was $89,000.
Sure.
I think that's insane. So when I look to them and their percentages of that below 50%, it makes me say maybe to your point, maybe we need to uninstall the government, just like a computer program. Let's do an uninstall and delete.
Right.
And then see what we've got. What do you think?
Well, I think those are all good ideas. In the case in Oklahoma, and I'm nearly certain it's Oklahoma, they actually took to listing the prices that they charged for particular surgical procedures, and lo and behold, the hospital took to actually knowing how much they were charging. So people, because they had so many people calling and asking, apparently there is enough people with high deductible insurance that have to actually pay for their medical care out of pocket, and so they're interested in knowing what these things cost. That's the market at work, and that's what we could have everywhere across the country if the federal government would apply the Commerce Clause, in my view, properly.
We're going to get into that. I can tell you though, but to your overriding point, the over the last number of years, I've been calling on citizens to, when they have a non-life-threatening emergency but need medical care, to call and shop for best prices, best care. And everyone that I've talked to, or the vast bulk of the people that I've said that to, have pushed back and said, well, they won't do that. They won't let you do that. I thought, what do you mean they won't let you do that? Demand it.
Right.
If they want your money, if they want to receive, but it seems that the bureaucracy is so grand that a lot of, and I don't want to paint with a big brush, but it seems like a lot of our healthcare industry and the insurance carriers feel pretty insulated from shoppers. And boy, that's some wrong-headed thinking.
Yeah, they're insulated from shoppers, and there's a certain amount of arrogance in the medical community, and you can understand how that would develop.
You touched on the Commerce Clause. How does that apply here, Nick?
Well, if they were applying the Commerce Clause correctly, then insurance carriers would be able to sell their products across state lines. That's what the Commerce Clause is all about. It's about eliminating or not setting up to begin with artificial trade barriers among the states. And so, yes, the state of Michigan, for example, has the right to regulate its insurance carriers, those that are situated inside the state, but they would have a lot less regulation if other insurance carriers were allowed to sell their products to me inside of Michigan. And frankly, there's an insurance company I'd like to do business with but can't.
Because
they're not allowed to sell me the product that I want in Michigan.
What do you say when Jeff Hansen or those Republicans that voted for Medicaid expansion, because I asked him, what do we do when the funding is run out? By the way, he's way more versed on this than me, so I don't want anyone to think I'm taking from him. But when he said to me, what he said is that once the money is comes out, then that law automatically comes to an end, and it would take a new legislative act to re-engage it if the funding stops from the federal level. Is that how you understand it?
That's the way I understand it. I'm going to take him at his word. However, the idea that you're going to get a whole bunch of people in Lansing to kick people off from insurance policies or Medicaid after they have dropped their current insurance policies, and that's an important point to remember. There's going to be an awful lot of people that drop perfectly good insurance that they're currently paying for,
right,
or part of through their employers in many cases. Now you're going to have politicians that are saying, okay, all of those new people have to find other arrangements. Suddenly, I don't think there's going to be political will to do that.
Well, I was thinking, probably along the same path as you. If there was political will to add them, that it's not likely, to your point, that there'd be political will to then subtract them. The problem that I have with it is the obvious problem of if there's no more federal funding, and I believe Obamacare will fail, or it may remain, but it will be so greatly altered from its current state, I don't think it's sustainable. So that funding source inevitably is going to get twisted up. But when I look at it, I can't imagine where Governor Snyder, the Democrats, the Republicans, those folks that supported this, I don't know whether I agree with you. It's not going to go away. So the question would be, how are we going to fund it?
Well, the governor's already acknowledged that it's going to cost Michigan taxpayers money. This isn't just a situation where, hey, golly, we're getting a whole bunch of federal money, so we might as well spend it.
Right.
He said that they're going to put a certain amount of money aside for the day when those subsidies start to dry up. And if I'm not mistaken, they begin to diminish today. In 2014, it's 100%. But as soon as 2017, it goes down to 95%, and then 2020, 90%. Now, they've said 470,000 people they're going to add to the rolls. My guess is that estimate is very, very low. A lot more people are going to end up signing up than they're estimating if Maine and New Mexico's experience is any indication. They were nearly four times as many people enrolled, dropping their current insurance. This is going to be a disaster. And so having said that we're going to put some money aside for the time when these subsidies dry up, they know that this is going to be a disaster, or they should anyway.
So when Jeff Hansen, Senator Hansen, when he said that what we're in effect doing is we're already paying into this process. We're forced, our employers on our behalf are forced to pay in. And it's his understanding, or at least what he articulated, is that this is just us getting that money back that we've already paid. Do you agree with that statement?
At this point, the employer mandate hasn't started yet. There isn't any provision to tax employers in Michigan yet, is there? I may be mistaken, but I don't think that's the case. At this point, the employer mandate didn't kick in because President Obama illegally changed the law so that he wouldn't have an economic disaster just before the election.
Well, we'll take a dovetail. How is that illegal?
The president can't just change the law all by himself. It requires an act of the legislature.
I think he's done it 27 or 28 times.
Well, by now, it's amazing that you're able to keep count.
Well, it's fortunate. Once it gets above 50, it's kind of hard, but we're under 30. I can still follow the path.
Fair enough.
So the bottom line, though, you're saying get government out.
We don't need government in medicine. This is what's caused the problem to start with.
Well, let's stop for a second. What would the picture look like without government? I want to make sure I understand what vision you're casting for us. There's no government. What do we do about health care?
Well, first off, people would buy insurance. The sort of insurance that we have now, subsidized by employers, and the big employers, interestingly, they get to get a little bit of a tax break. And so they're able to keep good quality employees by subsidizing their health insurance.
You're talking about cafeteriaing?
Whatever they're doing, they're able to write that off as a business expense. That's part of the compensation package. Individuals, on the other hand, until very recently, haven't been able to write that off, and then it's a little bit complicated when you do on your tax form. It's unfair, and individuals naturally, they were passing laws recently that said that people were allowed to take their insurance with them. If you bought your insurance yourself,
Right.
Wouldn't be subject to employers. And my guess is the price would come down. People would buy insurance. I mean, I listened to a guy on a talk radio program going on about how much it cost to get some medical procedure, and his deductible went up from $10 to $100, and he was really angry that he couldn't just go in with his $10 and get cured.
Right.
And the talk show host asked him, facetiously or not, how much did your television set cost?
Right.
Well, $600-800. Got a big screen TV on the wall, and he can't afford $100 to go and get his leg set when he broke it.
So I want to make sure I'm understanding the path we're on with that, Nicholas. Are you telling me that healthcare ought not to be free?
Healthcare shouldn't be free, and people
Right.
ought to expect to have to pay their doctor, somebody that goes and trains and spends years and years in universities, and then several years in hospitals, virtually living in the hospital. When you look at a guy in a residency, people have this idea that doctors are spending their days on golf courses.
Right.
I think most people would be surprised at the longevity statistics of doctors. They're dying much younger than the rest of us are.
The burnout rate is very, very high.
Yeah.
But their administration, if Senator Hansen is correct, the administration or the bureaucracy that surrounds those doctors is what's costing the money, and not necessarily the doctors themselves.
Sure.
Do you think that's a true statement?
I think that's a fair point. And people say, well, Medicaid reimbursement rates are lower than the other ones. But one of the reasons that we have the increase in cost in hospitals, the medical care in general, is a thing called DRGs. Back in the 80s, as far back as the 80s, the government thought that hospitals and doctors were ripping them off. So these people are charging us way too much money for these procedures, and so we're going to have diagnosis-related guidelines. And so if you come in to the hospital blue, we're going to make the doctor check on the box and check on a form. Looks like a heart attack to me. The guy's blue. And so if it turns out that it's something other than heart attack, you don't get paid for curing him.
Sure.
You start running other tests. And so this is what, originally what was called defensive medicine, although
Right.
it's come to mean something else today. Well, I got to check all of the boxes
Well,
for
today,
what might cause this guy to turn blue. And if I don't run the test later, if that guy comes in a month from now with some other condition that caused him to turn blue, I've lost the lawsuit before I even started.
so it's all about litigation.
It's a good part of it's about litigation, but it's also about running unnecessary tests. If I check the box that says he's blue, he's had a heart attack, I zap him back or give him some epinephrine, whatever it is, send him home to his loving wife and kids, and he shows up next week with a different condition,
Right.
I've been negligent.
Okay.
Now, in the first instance, the guy goes home, and there's no reason for me to think that there's some other condition there. It's not negligence. It's,
So you're saying that we're doing all these testings because of the litigious culture we're living in?
well, not only that, but because the government has this idea that doctors are ripping them off.
Why?
And it's
Do you
simply
think-
not true.
do you
Until
think-
after they set up this system, it makes it necessary almost for doctors and hospitals to run more tests than are necessary under the circumstances.
Do you think that's government, or do you think that's a populist politics that runs rampant in America that kind of suggests doctors are rich and they're taking advantage of us, and so it's within our right to try to sue them for everything they're worth? You follow what I'm getting at with that?
I guess I follow what you're.
It's kind of like
you could do an awful lot of good in the country simply by having better informed juries, frankly, and maybe jury of peers ought to actually mean something.
Yeah, to me, whenever I hear about the litigious side of the health industry, on one hand, if a doctor is truly negligent, there probably should be a award. I'm not questioning that. But on the other hand, it feels like there's a whole bunch of ambulance chasers, and I'm often reminded of the person that goes to the supermarket, throws an egg out in front of them, and when they get to it, they slip and fall and sue.
Sure.
So I think we've really got to be careful what we ask for when we're looking at tort reform, which is really what I think we're talking about.
Sure.
Is that right?
Yeah, I think we could do with a little bit of tort reform. I mean,
How about loser pays tort reform?
that seems like a good idea, and I'm not going to make an awful lot of comments about tort reform right now, just on account of it's not something that I've thought an awful lot about. Loser pays strike me as a way to keep ambitious lawyers from taking on sort of frivolous cases.
Yeah, and that to me is part of the healthcare industry problem. Are those ambulance chasers, for lack of better terminology. And again, I'm not saying all lawyers are that way,
Sure.
but there certainly is enough of them to be a part of the problem and not part of the solution.
There's an awful lot of problems in healthcare, but if you look at any other area of society, in any other area of market economics, you discover that freedom works better, and there's more mandates and requirements in healthcare and education than there is in any other area of American life, and it's no surprise that those are the areas with the highest inflation rates.
No question. Nick, we're going to go to break. Folks, we'll be right back.
Are you one of the many Americans who undergo CPAP or BiPAP therapy? Replacing your supplies every 3 to 6 months is critical, as bacteria will build up and worn-out straps cause leaks. Call Allied Medical Supply Network and speak to an expert agent who will set up a schedule for your supplies to be delivered right to your door at little or no cost to you. Call Allied Medical Supply Network today and rest easy.
Call 800-284-2512. That's 800-284-2512.
This is a national health alert from Worldwide Medical. Are you on Medicare? And do you suffer from back or knee pain? Have you tried injections, pain pills, or even had or considered surgery? If these examples apply to you or a loved one in pain, stop. There is a better way. You could qualify to receive a pain-relieving back or knee brace at little or no cost to you. You'll receive free information, free delivery, and all the insurance paperwork is handled for free. Best of all, there is little to no cost to you for the braces. Call 1-800-282-6789 to get all the details. It takes just a couple of minutes. These amazing braces have helped thousands of people in severe pain, and you may qualify to have yours delivered directly to your door at little or no cost to you. Call 1-800-282-6789 right now. This may be the most important call you make all year. That's 800-282-6789. Call now.
I use catheters, and if you do too, please listen carefully to this life-changing breakthrough. There is a new catheter that hurts less, and you can get a free sample by calling this number now.
Pain and urinary tract infections have been avoided by many of my patients. These new disposable catheters hurt less. It's an incredible new design that reduces pain. The eyelets are polished, so they glide smoothly and effortlessly across your sensitive skin. The old catheters would scrape and cut, causing pain and infections.
These new catheters are totally different, so smooth and painless. They changed my life.
Call now and get a free sample. Medicare and your insurance will pay for up to 200 of these catheters per month, all at little or no cost to you. Medical Direct Club handles all the paperwork with your doctor and includes lifetime free shipping when you call and join. Membership is free. Call now and get your free sample and painful capping today.
Attention hip replacement patients. Several metal-on-metal hip implants have been recalled, and a jury recently awarded $8.3 million to one hip replacement victim.
Metal-on-metal hip implants can cause excruciating pain and may require expensive surgery to replace. If you had a metal-on-metal hip replacement and it's been removed or it needs to be removed, call the Goldwater Law Firm right now.
I'm attorney Bob Goldwater. Metal-on-metal hip replacements can be dangerous. If you have a metal-on-metal hip implant, even if it hasn't failed yet, call us right now. You may be entitled to substantial compensation.
The manufacturer of your defective hip implant should have to pay for your medical expenses and your pain and suffering.
Your time to act is quickly running out, so call us right now.
If you have a metal-on-metal hip replacement and it's been removed or is causing you problems,
Call 1-800-540-9516. That's 1-800-540-9516.
Welcome back to the Renegade River Show. My name is Mike Hewitt, and we're in today with Nick Sundquist, who is a Republican primary challenging candidate in the 34th District for Michigan's State Senate. Nick, one of the things I wanted to do before we get further into policy and your positions on the different issues is I want to pause for a minute and get a little bit better feel for your background and, frankly, why you're a candidate in this primary. So tell me a little bit about how many kids you got, what do you do for a living? Let me get a little quick bio from you.
I'm a small business owner and have been for approximately 20 years. I'm born and raised in Pinchtown neighborhood of Muskegon. Some of the older members of your audience may actually know where that's at anymore. I've got 4 beautiful children. Of course, I think they're beautiful. And a lovely wife. I recently had my 10th anniversary. And so, in general, I'm a really, really happy guy and mostly just lucky. I'm running against Mr. Hansen in the Republican primary in August, primarily because of his Medicaid expansion vote. Although his record, in my mind, from the time he was in the House until now, hasn't really been very good. We talked earlier about things that we can do to improve, reduce insurance costs, and actually improve care in Michigan. And I think those things are important. And Obamacare is not going to do any of those things. I'm really going to push hard for a part-time legislature, and there are other people in the state that will have a petition drive to put that on the ballot next time, and that's coming up. And when I get more word on that, I'll be sure to let you know about it. I'd like to eliminate corporate welfare programs. There's an awful lot of people out there that say we can get new jobs if we bribe companies to come to Michigan. And Mr. Hansen's been a big proponent of corporate welfare programs. His name is on the 21st Century Jobs Fund, it's my understanding. And if you look at those programs, what you'll discover is they don't create the jobs that they promise, number one, and number two, the economics of it just doesn't make sense. You're not going to get a net number of new jobs by taking money from hardworking taxpayers and small businesses in Michigan and giving it to otherwise successful companies, sometimes successful companies, from out of state. There won't be any net new jobs. You can see them there. You got new employees working over at Cabela's near Grand Rapids. But what we don't see is the number of people that didn't get hired at a small mom and pop store or someplace else because they're taxed to give a subsidy to Cabela's. The economy's not actually any better is what my point here is, and right. It's immoral to take people's money and give it to somebody else.
What I find interesting about government in general, and not necessarily Mr. Hansen, because frankly I've not looked at his voting record that closely, but when the government picks winners and losers, I use the word populist in the first segment, and to me that's a lot of populist politics. There's always somebody that says, yeah, we need to do that. I'm agreeing with you to a degree, but the problem with it is that you can't stop that unless we completely wipe out our current tax code and start again. And the reason I say it that way is if you look at I can do some numbers just because I know some of them. I'll use automobile dealerships as an example. The average automobile dealership in the state of Michigan is paying property tax approaching $100,000 a year. Property tax. And so if you were, to me, if you want to get into a situation where we're going to really attract corporate business from outside, we want jobs. I don't see corporations as this evil entity, whether they're little ones or big ones. I only see tax code as the evil entity. And what I mean to say by that is I think that, to your point, I believe that the taxes ought to be equal across the board. So if we're going to assign it to $1, it's my dollar is the same as somebody else's dollar. If they have 50 of them and I only have 5 of them, the percentage ought to be the percentage. But when we're getting to I don't think the average citizen walks into a dealership realizes that dealership is paying for $100,000 worth of property tax. What causes me to shake my head a little bit is that there will be a lot of people that think that's a great thing, except for the fact that they're the ones paying for that property tax.
Right. They're unaware that the profit's got to pay for all that.
They'll walk out saying, wow, that dealership sure charged me a lot of money. Well, that's because you wanted the property tax at $100,000. So what we need to do, in my view, and you tell me if I'm wrong from your point of view as a candidate, is I think that we need to find some system that actually adds up all of these taxes, maybe add them up by getting rid of them and starting afresh. What do you think?
I'd be all for that. most assuredly. Tax ought to be fair, number one, by percentage, and not by some sort of nebulous idea of someone's idea of fairness. It ought to be easy to bear and simple to calculate. That's the way taxes ought to run. I'm with you. It's easier to tax businesses because everybody thinks that businesses they've got all the money and I'm poor because of them, and you have an awful lot of that populist sentiment, and it's wrong. The other thing, you talk about corruption. It's class envy, but it's also caused corruption in politics. People say, well, the businesses are buying politicians. Well, in some cases that may be true, but my guess is, as often as not, it's politicians shaking businesses down. If you're a widget maker and I happen to sit on the committee that regulates widget makers, I'm going to give you a call and say, hey, Mr. Hewitt, I've got some legislation coming through my committee, and I thought maybe you'd like to comment on it. And by the way, did I tell you I'm running for re-election? My guess is that happens as often as somebody from the corporation saying, hey, I really spent a lot of money making these new light bulbs. Couldn't you pass a law that says everybody has to buy the ones that I make?
Yeah.
I'm sure it happens both ways. The problem isn't special interest in my mind. People say, we got to get rid of those special interests, and you got some people giving money to save the whales and another bunch of people giving money to the NRA. That's special interest. We're all special interest.
Sure.
What the problem is that the legislators have way too much power to regulate our lives. Yeah. That's the real problem.
To everything there's a pushback. So let me give you a couple examples, and you'll know this from being a candidate. If with the finance reform for candidates, you have to declare. So you give me $10 to my candidacy, I now have to declare it. And I say, Nick gave me $10. This is his address. This is what he does for a living. Here's his phone number, and then it's posted to the internet.
Yeah, and you have to tell me where you work, too.
Absolutely.
It's all on there, and it's posted on the internet.
Now, you could tell me which position you take, because I wrestle with that a great deal. On one hand, I want the transparency. I really want it. On the other hand, as a person that gave $10, to me, it's the same as demanding to know who I voted for when I walk out of the booth.
Absolutely.
And I have a problem with that. It's none of anybody's business.
We all understand almost instinctively why we have a secret ballot, and that's so that the winner can't come looking for you and cause you, seriously,
Yeah.
He can't come causing you all kinds of problems if you voted for the loser.
Right.
And to put your name on a list of people that gave money to the loser is possibly dangerous in the United States today with the amount of power that regulators hold over us.
It seemed to me,
frightening.
I used to refer to the campaign finance reform, at least on a state level, it was like the Incumbency Protection Act.
Well, I think that's what it's designed to do, and that's probably the reason the big corporations often give to both parties at just about equal rates. No, a lot of people think we need to know, and I understand the feeling. Like, it would be nice to know who's supporting which candidates and which parties and all the rest of it, but I think we've got more serious problems if we can't figure out who's the likely beneficiary of a particular piece of legislation.
Tell me something.
We don't need to know.
Let me take you in a little different direction, if I might. You mentioned the word party, and I want to get your take on party politics in America right now. What do you think the state of party politics is in America? Or specifically, you're a primary challenger in the Republican Party. What do you see when you're looking forward for the Republican Party?
If the Republican Party doesn't begin to follow its platform, the Republican Party is going to continue to lose races. If they follow their party platform, we would be having honest debates in the country, and conservative people would get out and vote.
Okay.
Now, I don't have the hard numbers for it, but I think that the reason that Mitt Romney lost the last election was because people looked at him and said, well, he's a nice guy, but on all of the major policy issues, he's not really any different than the other one. And so why am I going to go out and vote? Nothing's going to change. Why am I going to go out and vote?
Yeah, in the first segment, I mentioned Reagan and his bold colors versus pastels.
Sure.
And we hear a lot lately in the media, and frankly from grassroots, about rhinos versus establishment versus grassroots, and all these different labels we're throwing out. But I always smile when I hear that stuff, because Reagan, back when he was challenging a sitting incumbent Republican president, he gave the speech. That's when he gave the speech, was from the RNC convention. It was bold colors and pastels. We have to be about bold colors. In other words, we have to be about differences. And of course, we didn't use the word establishment back then, or at least I didn't. But the folks that had been in the know for a long time, the consultants, et cetera.
Rockefeller Republicans then.
Exactly. Now I call them Nixon Republicans because I like that so much better. But they pushed back quite hard on Reagan. He was an extremist. He was this. He was that. But and then he had an incredibly sweeping victory with his bold colors differences. And it's one of those things where I always pause, because we never seem to be really good at reading history. And by the way, on the Romney issue, I absolutely agree with you that there was very, very little difference. When I look at Obamacare, it is an echo of Romney care.
Sure.
And to say it isn't is just fibbery.
It's my understanding that some of the consultants that helped Mr. Romney build it in Massachusetts actually worked for the Obama administration, building it nationwide.
Including Romney, who went to the White House to help.
I wasn't aware of that piece of
so
information.
when you sit back and look at some of these things, listen, I'm a Republican through and through, but it causes me some consternation, some concern. In fact, one of the reasons we're doing this show, and one of the ways the reason I'm formatting it the way we formatted it, is so that we can give those bold colors. I want the differences. I want, in your case, you're challenging an incumbent. I remember when I did that in 2004. There was no Tea Parties, there was none of that stuff, and people looked at me like, what in the world are you thinking?
Sure.
The lady I challenged, she's a nice lady. We have some differences. They're respectful differences. They're not mean-spirited. I consider her a good friend now. But I think it's important. I think this is how we steer a party. That's why I asked you about it, about where your view of the Republican Party is. I think these are good, healthy things.
Well, there's no getting around that the Republican Party, especially in Michigan, I think has some pretty serious problems. And as I said before, I think if they would follow the Republican Party platform, there's some pretty bold things in there, at least that sound almost radical to people in Michigan. You talk about liberty and justice. I don't know, sort of. People think, well, we got liberty and justice in America. I can go and do what I want to do and read what kind of books I want to read and listen to whatever kind of music I want to listen to. But I got to go and get a license if I want to be a barber.
Yep.
I don't know how many different occupations that a young fellow ought to be able to go into without getting certified by the state government. There are all kinds of crazy little things like this that people don't really pay any attention to. And you ask yourself what the world would look like if we had government that made sense, a government that was designed to keep things regular in its regulation, as opposed to, as you say, picking winners and losers, or picking winners and losers. Yeah, an awful lot of regulation is what's known as rent seeking. When you talk to read economic books, we like some of those big companies actually like the regulation. It keeps their competition out.
Right. One of the things I was thinking while you were talking, though, Nick, is you talked about if we actually had government that makes sense, and I have to tell you, I've been in activist politics for a long time, and I've noticed over that period of time that if you get 10 conservatives or 10 libertarians or 10 progressives, 10 whatever you want, and try to get them all to agree on a particular topic, oh, mackerel, it's truly like herding cats. I say that because, and what I'm getting at is that your idea of government making sense clearly is not necessarily entirely that of Jeff Hansen's, and the Democrats would really dramatically disagree with both of you, by the way, because in truth, your difference only on 4, 5, or 6% of the issues between you and Hansen. And that's what a primary is about, is trying to define those differences, in my view. But what I'm getting at is that coming up with a logical government is tough, because everyone's different, has a very, very differing view of what good sense government means. It's like the old thing: what what is a proper role of government? I mean, that question gets asked every single day of somebody.
We need to have government to settle disputes,
right?
Between, honest disputes. We need to, enforce contracts. We need to have policemen to look for people that have committed crimes, and those crimes ought to be property or physical crimes against people. Soldiers to protect us from the foreign invaders, and that's just about it when you get right down to it. I can't think of most of what government does, in Washington at least, is patently unconstitutional. If you actually look at the Constitution and understand what's going on. And in the state, most of the government that we have is not only unnecessary but detrimental to our well-being. That's my opinion. And I'd be happy to, people say, well, don't we have to have this agency or that agency? I'm going to challenge you to give me an agency that does some regulatory thing, and I'll tell you how it actually hurts us more than it helps us.
Sometimes the agencies have become pseudo-lobbying organizations. You talked earlier about special interests. A lot of those agencies exist as a result of special interests, and they've actually become, EPA as an example. There's a great example to me, my way of thinking at least, has become an extension of lobbying organizations that were pushing those special interests that now are represented by policymakers that don't have to deal with law, because they can make policy that are earth-shattering to the lives of many.
No, that makes sense to me. I look at the example of the meatpacking industry. You got a guy standing at the end of the assembly line in the meatpacking plant stamping here. Now, he can't see bacteria any better than you can. Now, people say, well, we got to have, our meat inspected, otherwise we go to the grocery store, we'd all get sick and die. A perfect example of how this makes us less safe is that the smaller meatpacking houses can't afford to keep that guy on staff. And here in Michigan in the 70s, they were required to actually pay him. And then they passed a law that said that they had to provide him with his own bathroom. Okay? The intent of that law was to put all those smaller outfits out of business. Now you've got 3 or 4 major meatpacking houses in the whole country, and every so often you'll hear them how they get the hamburger is tainted, and it's under 15 different labels in 5 different states, and nobody knows which package it is. We're arguably much less safe than if you could look at the sick guy and say, where did you get that meat? I bought it at the local grocery store. You call the local grocery store owner, and he says, I got it from ABC Packing House. Take that cow off the market, ABC Packing House, and we've got a localized problem. It's not all over the country, and we're a lot safer.
We're going to pick up on that when we come right back.
Super.
Attention hip replacement patients. Several metal-on-metal hip implants have been recalled, and a jury recently awarded $8.3 million to one hip replacement victim.
Metal-on-metal hip implants can cause excruciating pain and may require expensive surgery to replace. If you had a metal-on-metal hip replacement and it's been removed or it needs to be removed, call the Goldwater Law Firm right now.
I'm attorney Bob Goldwater. Metal-on-metal hip replacements can be dangerous. If you have a metal-on-metal hip implant, even if it hasn't failed yet, call us right now. You may be entitled to substantial compensation.
The manufacturer of your defective hip implant should have to pay for your medical expenses and your pain and suffering.
Your time to act is quickly running out, so call us right now.
If you have a metal-on-metal hip replacement and it's been removed or is causing you problems,
call 1-800-540-9516. That's 1-800-540-9516.
There is a new catheter that hurts less, and you can get a free sample by calling this number now.
Pain and urinary tract infections have been avoided by many of my patients. The eyelets are polished, so they glide smoothly and effortlessly across your sensitive skin. Medicare and your insurance will pay for up to 200 of these catheters per month, all at little or no cost to you.
Call now for your free sample. It will arrive with a complete 90-day order, and if it doesn't reduce your pain, we'll pick them up for free.
This is a national health alert from Worldwide Medical. Are you on Medicare? And do you suffer from back or knee pain? Have you tried injections, pain pills, or even had or considered surgery? If these examples apply to you or a loved one in pain, stop. There is a better way. You could qualify to receive a pain-relieving back or knee brace at little or no cost to you. You'll receive free information, free delivery, and all the insurance paperwork is handled for free. Best of all, there is little to no cost to you for the braces. Call 1-800-282-6789 to get all the details. It takes just a couple of minutes. These amazing braces have helped thousands of people in severe pain, and you may qualify to have yours delivered directly to your door at little or no cost to you. Call 1-800-282-6789 right now. This may be the most important call you make all year. That's 800-282-6789. Call now.
Are you one of the many Americans who undergo CPAP or BiPAP therapy? How often are you replacing your masks and hoses? Replacing your CPAP or BiPAP supplies every 3 to 6 months is critical to an effective therapy. Bacteria will build up, making you sick, and worn-out straps cause leaks and are just plain uncomfortable. Let Allied Medical Supply Network help. Call Allied Medical to speak to an expert agent that will determine which supplies you need and will set up a schedule for your fresh, brand-name supplies to be delivered right to your door, right when you need them. Shipping's absolutely free, and you may qualify to receive supplies at little or no cost to you. That's right, there's no driving around town or remembering when to order. Call Allied Medical Supply Network today and rest easy.
Call 800-560-7631. That's 800-560-7631.
Welcome back to the Renegade River Show. My name is Mike Hewitt, and we're in today with our guest, Nick Sundquist, who is a candidate for State Senate in the 34th District of Michigan. Nick, when we left off, we were talking about regulations, but if you don't mind, I want to change gears a little bit. Where are you on Common Core? How would you have voted for Common Core?
I would vote against Common Core, and I think had I been there, I would have insisted on a voice or on a actual counted vote. So this is an important enough issue. We need to know where all of the people stand on Common Core.
Why are you against it?
People talk about standards, and I've talked to some people that are against it because of data mining and a whole bunch of other what I regard as legitimate concerns. But the reason that I'm primarily against Common Core isn't so much that there are standards. It's that when it comes to the education of my children, I believe I'm entitled to some choice in the matter. And it doesn't really make any difference to me whether I've got to go to the local school board to get my kid in a classroom that makes sense for my kid, or if I have to go to the state legislature, or if I have to go to the federal government. Why do I have to do any of those things? I ought to be able to choose a school that makes sense, it conforms with my values, and send my kid to that school.
How does Common Core stop you from making a choice? I don't get it.
How does Common Core stop me from making a choice? The curriculum, it's a federalized curriculum.
But when I talk to the Common Core people, they tell me it's absolutely not federal, that it's state by state. Just a majority of the states have signed on. What say you?
Well, okay, to the extent that the states have signed on, and now here in Michigan, it's my understanding we have signed on.
We have.
The federal government is in charge of the curriculum, and it's a carrot-stick approach. We're going to give you a whole bunch of money to keep your teachers' unions happy if you'll sign up for this common set of values. It's wrong, and it's not going to help educational outcomes. Here's the most important thing to remember when you're talking about education. For years and years and years, teachers have been grumbling about teacher-student ratios in the classroom.
Right.
They're much too high. We got too many kids in there. Did you know, for example, and maybe some of your audience will be interested to discover that since 1940, administrative and support staff in public schools in the United States have increased by 700%.
Right.
We got a management issue, and the only way to take care of management issues is either hostile takeover or out and out competition, free for all. And the beauty of competition is that there isn't any one curriculum that makes sense for every family in the state of Michigan or across the whole country. If you have a child with special needs, you don't want to wait 2 years for the state legislature or the local school board to get a program that's designed to help your kid. If you have a child that is having difficulty learning to read, you shouldn't have to change the whole word method for students all across the state because you recognize that phonics is going to do the job better. And you're already being taxed exorbitant amounts to keep these schools in business. You ought to be able to take the money that's spent on education and put your kid in a classroom that makes sense for you and your family. And the beauty of this is, the teachers are going to be able to actually do their jobs. If you listen to the legitimate complaints of teachers, well, the class size is too big and the administration won't listen to me when I've got this idea or that idea, in a private business is going to be interested in getting more students, aren't they? We want to get more students, same as the schools are now, but they just force you to come. They're going to want to produce a quality product. And so the kids that go to private schools, like Catholic Central, are going to know how to read, write, and do arithmetic when they get out of there. 96% of the students that go to Muskegon, and I'm not just advocating for Muskegon Catholic Central, it's one example that I'm aware of here. There's a Lutheran school in Milwaukee in a neighborhood that's every bit as bad as Muskegon Heights.
Right.
The parents are just slightly more aware of their children's surroundings than some are because they have to sign up for a lottery to get their kids out of the failing public schools there and get them into that Lutheran school. Did you know that close to 93% of those students are now going on to college?
Yeah.
There's nothing wrong with these kids' brains. They can learn. They just need to be taught.
You're helping me with a word, college, because that's where I was going to take you next. From 1980 forward, the United States income has enjoyed a 200% increase. I think that's inflation, so I use the word enjoyed a little bit tongue-in-cheek. But we went from, it's been a 200% increase in average income. Higher education has had an 800+% increase in cost. So the tuitions today now, and we hear it all the time now, that people's student loans are on par and greater than mortgages on average. I got to tell you, I find that just amazing to me. But it's almost, and I dovetailed it with Jeff Hansen also, frankly. When I look at education and then I look at healthcare, those are the two issues, the two topics in America that our government they say they're helping us with. And I mean this quite sincerely, we can't afford any more of their help. Both of those from 1965 forward have just absolutely skyrocketed compared to what the average incomes in America have on. It's all, to me, it's just math. It's got, set all party politics and ideology aside. If you look at the math of it, it's insane. So as a state senator, what impact can you have on this if you agree it's a problem?
I agree. It is absolutely a problem, not even so much just because of the cost, but because of the indoctrination that we're getting in universities and grade schools, frankly. There ought to be a separation of school and state, in my opinion, for the same reason that we have separation of church and state.
Sure.
So long as the government is in control of something, the costs are always going to. Nobody can show me an example where the government took over some particular industry or something and the cost went down.
Right.
It's not going to happen. Competition, again, is key. You've got most of the people in your audience have more computing power in their pockets today, in their cell phones, than what it took to send a man to the moon. This is the power of free market economics at work. The less regulated any industry is, the faster its advances and the more it advances. There's no reason to suspect that it would be any different in education.
A fella told me a while back, a pretty learned fella, told me that what happened to education, that was the conversation he and I were having, what happened to education. He said that during the the Industrial Revolution following the Civil War, that there was a significant push on leadership level in America to create a lever-pulling, button-pushing society, meaning they didn't want critical thinkers.
Sure.
And so what they did is they looked to Europe education system, and at the time Europe's process or their educational goals appears at least that they were attempting to raise armies. We want you to march in that direction. Don't ask us whether you can march that way or not. We told you to march that way. And so that's the type of society they were trying to create. And so the American leadership at the time, back during our industrial revolution, looked to them and said, okay, we're gonna centralize our education, and that's what we're trying to do. Is we want to, like he said, to get lever pushers or pullers and button pushers. Do you think that's a plausible rationale? And the reason I ask it, and the reason I've given it so much thought, is I know that I've got a reading, writing, and arithmetic book that was written for 8th grade from the 1890s. And the average college graduate bachelor's degree cannot pass any of the tests from 8th grade.
I have a basic math book. At some point, I'll see if I can't remember to bring it with me next time. You'll be amused by the content in the basic math book. Most of it's better than college. And what you say is absolutely true. I encourage your members of your audience to look up John Taylor Gatto on the internet. He gives a very good description of the advent of public education in New York. And it was sold to the public as a sort of a religious thing. Protestantism and Americanism were regarded as almost synonymous at the time, and they had an awful lot of Catholic immigrants coming into the country. But the real reason for it was, as you say, we don't want a whole lot of critical thinkers. There was an Englishman that went to a Hindu school and looked around and said, hey, these people really don't ask a lot of questions, don't expect a lot more than their fathers had, and everybody's reasonably happy. If we need this in England, they had a lot of factories in England.
Sure.
We want a guy to show up in the morning and go home at night, ask a lot of questions, and never bother to ask for a raise.
We've come a long ways from founding fathers that wanted a virtuous and informed society.
Sure.
And in fact, most of them profess that the republic would last as long as that's what we had. And so now you go, holy mackerel. Of course, teachers, listen, I'm not slamming teachers because a lot of them do a good job, and to their point, if there's any failing, it's not necessarily entirely them. It's bureaucracy, to your point, administration, but parents have to take an active role. And so if you go to the local school board meeting and there's virtually nobody there,
sure.
I mean, that's part and parcel of how all of these things are components. But hey, we're down to just a few seconds. How would a potential voter, someone interested in your campaign, get a hold of you?
If I have said anything that interests anybody here today, or if anybody has any other questions for me, you can look up Nick, the number 4, Senate.com. There's an easy Facebook link there and an easy email link. You can do that. You can call me. I probably don't have the card right here, but send an email there. And
Nick for Senate?
Nick, the number 4, Senate.com, and I'd be happy to answer any other questions you have.
Very nice.
Thanks
very nice.
much.
I appreciate you, Nick. And folks, you can find the Renegade River Show on Facebook. Thank you very much. We'll see you next week.
Brought to you by Renegade River.
Are you one of the many Americans who undergo CPAP or BiPAP therapy? Replacing your supplies every 3 to 6 months is critical, as bacteria will build up and worn-out straps cause leaks. Call Allied Medical Supply Network and speak to an expert agent who will set up a schedule for your supplies to be delivered right to your door at little or no cost to you. Call Allied Medical Supply Network today and rest easy.
Call 800-284-2512. That's 800-284-2512.